My name is Antley. I'm a physician from Vermont, the United States, and I'm delighted to be here today. Thank you for having me. Hard act to follow. I'm going to do a lot. There are a lot of slides here, so I'll go really quickly, and hopefully we'll get through them all. I don't know for sure. So I'm a board-certified anatomic and clinical pathologist and subspecialized in dermatopathology, so I'm triple boarded, and I'm a laboratory director back in Vermont. The last 10 years I've been very active at the level of the medical society in Vermont, where we considered and then legalized and commercialized marijuana. The medical society came out opposed to this, of course, and I've written all of the resolutions actually that passed the medical society in Vermont, together with my friends and colleagues. I'm co-founder and I serve as treasurer of ISAC, the International Academy on the Science and Impact of Cannabis. We try to bring physicians' voices to this conversation. So lots of slides and lots of references. You can go back to them later. But this first one, health impacts of marijuana policy and legalization, is the topic of our talk. In the United States, we have legalization followed by a significant increase in cannabis addiction in kids 12 to 17. In 35, in Oregon, we saw allowing recreational marijuana sales was associated with increased past 30-day marijuana use in adolescents, and this was linked to increased retail shops. And so we see this link between retail shop density and increase in use in our youth. In a statewide survey in California, similar story, recreational marijuana resulted in an increase in adolescent use when you look at 17-18 to 2018-19. We know, as Ronit said, cannabis is addictive, even though the other side says repeatedly that it's not. Of course, our addiction is greater in kids, adolescents, than it is in adults. And adolescents misuse cannabis at a higher prevalence. Cannabis withdrawal is real. We have withdrawal symptoms. They're well described in numerous studies. And 47% of regular users will experience withdrawal. And they include things like insomnia, shakiness, loss of appetite, sweats, anxiety, irritability. But what's important is if you look at day 14, you have an increase in aggression and anger, which is something that we're seeing playing out when people try and stop their marijuana use. This slide's from Dr. Alan Butney. He's a professor at University of Vermont. He's also a professor at Dartmouth Medical School. And he looks at cannabis addiction and treatment, especially in youth. What is working in treating our youth? And he finds that success rates in really state-of-the-art treatments. So you take a kid, you give them cognitive behavior therapy, they complete the treatment successfully, and afterwards, what happens? Well, as he says here, the outcomes are grim. Only 10% of kids who complete their treatment a year later, 12 months later, are still abstinent. We are learning that opioid misuse is impacted by marijuana use. It's not actually helpful. The #1 risk factor for adolescent opioid misuse is ever having used marijuana. Predominant factor for adult opioid misuse is having used marijuana before the age of 18. Cannabis use increases the risk of opioid use disorder. Cannabis impacts your cognition. We all know this, right? Cannabis makes you dumb, as Dr. Gamer says. According to Pelker et al., positive urine THC is associated with worse performance and episodic memory and processing speed. This well-known study from Mayer et al. It's an older study, looks back 20 years, and they found, of course, that IQ dropped like 10 points over persistent use. Sadly, cessation of cannabis did not fully restore function in these folks. And then the MRI studies are really interesting. The Battistelli et al. Did these MRI studies. They looked at, in Switzerland, kids 18 to 30, kids who are using, kids who aren't using, and they're seeing significant gray matter reduction in areas functionally associated with emotional and effective functioning, motivational, emotional, and effective processing. So this is super interesting when we understand that the development of substance use disorder is associated with altered brain activity in these same areas. So this gives us insight into how cannabis changes the brain anatomically and sets folks up for use disorder, which is also impacting birth and learning and cognition. This is another MRI study, which is super interesting, and it's actually ongoing. But what this shows is that kids 14 to 18 who smoke just once or twice in their life have significant reduction in their brain gray matter. And that's also, they also did behavioral measures, and they also had behavioral changes that went along with that. As Dr. Lev said, we have this mounting evidence that cannabis is impacting your cardiovascular, your cerebrovascular, and your peripheral vasculature. I could talk for hours about this, but it's too much detail, and we'll move right along. But this is an emerging area that's very important. This is a study that just came out last month, and basically cannabis use, smoking, vaping, eating marijuana associated with a higher risk of heart attack, stroke, heavier use, more days per month associated with higher odds of adverse outcome, even in someone with no pre-existing heart conditions and in someone who doesn't smoke tobacco. So we're not having a compounding influence here. It is the marijuana that's the problem. And this study also found that the risk climbed. In other words, the more days of marijuana that you use in the past month, the higher your risk of cardiovascular, cerebrovascular, and peripheral vascular disorder. Well, we also have, can't go forward. There we go. Cannabis and suicide. There we go. Cannabis and suicide. NIDA came out with a study. This is also something that's impacting our legalized states all over the United States. NIDA came out with a study, looked at 280,000 people, and they came to the conclusion that cannabis use is associated with increased thoughts of suicide, increased suicide plan, and increased suicide attempt. We all know that folks who have PTSD, who also smoke marijuana, twice as likely to try suicide, twice as likely to have suicidal ideation or thoughts. So this idea that veterans should be smoking marijuana is absolutely false. They should not be smoking marijuana if we want them to do better. There's a great study out of Montreal, just north of us in Vermont, Govey et al., and they looked at 23,000 subjects, and they showed that cannabis consumption in adolescence is associated with increased risk of major depression and suicide. There's two studies that came to similar conclusions. Again, if you use marijuana as an adolescent, your risk of having suicidal ideation and severe depression later on in life is increased 7 times. And in Colorado, this is the Colorado line. Here is the United States. Suicide's going up all over the United States, but in Colorado, the line is much steeper. They do autopsies on all of their teen suicides, and they do toxicology, which does not happen all over the United States. If you don't measure it, you can't find out, can you? But they are in Colorado, and cannabis is now the substance most often found in teen suicides. It used to be alcohol, and now it's marijuana. So now it's time for psychosis. And this is, we're often asked, is it just association or is there causality? I'm asked to give this talk a lot, and some people have very strong opinions about it, but I think at this point the science is clear. Cannabis impacts health in many ways, but perhaps the most devastating is its link to psychosis. Lung cancer kills its victims in their 50s or 60s, 10 to 20 years earlier than they normally would die. Severe mental illness attributed to cannabis smoking can devastate a marijuana user's life in their early 20s and impact the family for years to come. And folks who have schizophrenia also die decades earlier than they normally would do. What's important to realize is that family members and loved ones of those suffering from schizophrenia also have impacts to their mental and psychological and physical health. So they're also harmed, and financial health as well, actually. As Dr. Kamer said, it is unethical to give a group of kindergartners and divide them into half, cohort-controlled kindergartners, say you're going to smoke nicotine, and then we're going to check on these two groups in 10, 20, 30, 40 years and see who has more cancers, who's died. The answer is the group that smoked tobacco has lung cancer at a much higher rate, and they're also dead about 10 years earlier. So that's horribly unethical. Of course, we can't do that. So how do we We all know smoking causes cancer. How did we come to that conclusion? In recent years, our understanding of the causal role of cannabis in severe mental illness, psychosis, and schizophrenia has been greatly expanded. And at this point, the evidence goes far beyond association studies, their randomized controlled studies, their genetic studies, and their complicated designs that all strengthen this case for this causality. Neuroscientist Dr. Christine Miller is an advisory board member of Isaac, and she's written this detailed report, analysis, and paper really on the evidence, assembling the evidence that cannabis is a component cause of psychosis, schizophrenia. And she used the Bradford Hill criteria, which is the same criteria that they used to make you all aware that smoking causes cancer, tobacco. And you can find her full article on the Isaac website. I'm going to run through these real quick, but you can go back. What is the evidence? Nearly half of patients who present with cannabis-induced psychosis will convert to full-blown schizophrenia or bipolar disorder with psychosis. That's huge. It's actually like 47%, but it's very high. Greater use of more potent products results in higher incidence of psychosis. We have high potency cannabis in Vermont, and in the United States, it's almost impossible to find Woodstock weed anymore. The active ingredient in cannabis, THC, when given to randomized, controlled volunteer patients, in the clinic, creates psychotic symptoms under controlled circumstances. The majority of patients who develop psychosis or schizophrenia using cannabis have no family history of severe mental illness or psychosis, schizophrenia. Cannabis beats all other drugs of abuse in leading to psychosis and schizophrenia. That includes methamphetamines, PCP, or chronic alcoholism. In some cities, nearly 50% of patients who present to their doctor or present to the ER in psychosis have, in fact, cannabis-induced psychosis, nearly 50%, resulting from their regular use of 10-15% THC. These severely impacted and mentally impaired patients would be well, but for their cannabis use. I'm going to skip some slides. New studies come out all the time. In 1964, when physicians and scientists finally linked smoking to cancer using the same criteria that we're now using to link cannabis to psychosis, there was public outcry. People were angry that they had been allowed to be misled by folks telling them that smoking was not harmful, even helpful. It's good for asthma, they said. Or that heads of the tobacco industry had testified to Congress under oath that nicotine is not addictive. As a result of this public outrage, and because some of the politicians were effective public health leaders on this issue, warning labels were required on packaging. Advertising was banned on broadcast media, and an ongoing annual review and report was ordered by the Committee on the Health Consequences of Smoking. We all know that accurate disclosures were made, after accurate disclosures were made, and effective prevention methods put in place, tobacco use decreased. Effective prevention is possible, and subsequently the diseases and deaths due to tobacco also diminished. We have effective prevention interventions which work enforced when provinces allowed edibles and high THC concentrates. Child poisonings in these provinces in Canada spiked. Child poisonings did not spike in Quebec, where there's a THC cap of 30%, and no legal candy offers. Ontario, Canada, ED visits for adults and youth increased when more retail stores were allowed. Outlet, concentrations, impacts, poisoning. THC concentration matters, and in this slide we see THC may actually be an environmental risk factor for cannabis addiction and all the problems that go along with cannabis use. Tom Freeman et al. At King's College London published this 16-year study looking at the Dutch experience. What they found was that in Holland, when THC went up, so the red is the THC concentration, when the concentrations went up, then a few years later, the green line is how many people you're admitting for cannabis addiction. There's a delay, but then cannabis addiction admissions went up. Dutch THC, they got a handle on it slightly, it came down. Subsequently, a few years later, same thing, admissions came down. So we know there's a definite link between THC concentration and addiction, and THC concentration and psychosis and other problems associated with cannabis. So this is a fantastic slide that's done by Dr. Bertha Madras, and I think it's really a wonderful representation of Dr. DeForte's study. And it's looking at first episode psychosis of varying and increasing THC potencies across Europe. And what we see is that where THC concentrations are very high, and use is also high, and perception of harm is low, places like Amsterdam, 1 out of 2 individuals who present to the ER with first episode psychosis would be well if they weren't using marijuana. So this creates obviously a huge, significant additional healthcare cost burden due entirely to cannabis. Hospitalizations related to marijuana increased quite strikingly as commercialized medical marijuana was introduced in Colorado. In Colorado, these are pediatric ED visits. Many of them have associated with psych visits, increased as recreational marijuana took hold. Same story in Canada. 2006, 2015, mental health hospitalizations for cannabis and psychosis tripled as the country legalized and commercialized marijuana. This is somebody I think we all should be following, Dr. David Hammond, out of Waterloo Public Health Department. Quebec has 30% THC concentration limit, and this, he shows, protects public health. Here we have Quebec in red, and here's Quebec on the lower line. So they're having less use of concentrates, they have less hospitalizations due to poisoning, and when you have less use of prohibited substance products, that's the same as less black market products. So folks on the other side who want to legalize everything and have no limit to the THC, one of the reasons that they say is we need to get rid of the black market. What Dr. Hammond is showing is that the opposite is actually true. Over the last decade, Vermont physicians have repeatedly warned of the risks of marijuana consumption and commercialization. Oh, here we go, sorry. Okay, and this is, so our law that we ended up passing in Vermont, the statute prohibits any product that's appealing to children. But this is what we have. These are in legally licensed shops in Vermont, all prohibited products. Not surprisingly, in the United States, our child poisoning rates have gone up 1,375%. In New England, our rates have gone up 1,500%, and in Vermont, our rates have gone up 2,000%. This is our recommended labeling, we pass resolutions every couple of years opposing legalization. The Medical Society, the last resolution that we passed, I distributed to everybody. It has a lot of background information on it. And this was our recommended label. After they passed it and said they were going to commercialize it, we said, well, we should weigh in and let people know what should be the label on this product. And this was our recommendation. So, warning, cannabis THC may cause psychosis, impaired driving, addiction, suicide attempt, uncontrolled vomiting, harm to fetus and nursing babies. Of course, we could go on, lung problems, cardiovascular problems, but these we thought were really important ones that people didn't know very well. Sadly, in Vermont, the Cannabis Control Board, which controls everything in marijuana, composed of 2 lawyers and 1 employee health person, decided not to use our label and instead used a 141 word warning, and they, which was inadequate by omission because it doesn't have psychosis, suicidality, or cannabis hyperemesis syndrome on it, and it's also illegible. No one can read that. They allowed it to be put in this 6-point font. And here, for some reason, they allowed it to be hidden under the nutrition label. However, it's well known, as you folks all know, and has been demonstrated both in the United States and abroad, that when correctly implemented, effective prevention methods have been shown to decrease addiction. It's not in your genes, it's not predetermined that you're going to have a use disorder or not. So these methods have been shown to decrease addiction across substances, and this here we have tobacco, alcohol, and marijuana. cultures, consistently across cultures and socioeconomic groups. When systematically implemented, changes have also been followed by decreased crime, decreased rape and violence against women, as well as actually have admissions for substance use disorder in the cohort of young men. Cannabis, as with cannabis, like other drugs, tobacco and alcohol, effective prevention begins by countering the prevailing misperception of benignity and replacing it with a frank discussion and acknowledgement of the risks and harms, using accurate, proven scientific data and the facts about the health consequences that can be seen with cannabis use. I have to dedicate this presentation to Patty, a friend of mine and a Vermont mother, who lovingly and competently cared for her family member with cannabis use disorder and schizophrenia for decades. Before she was overcome with crippling anxiety, and which suddenly transformed, we didn't understand why, into an unrelenting depression. Patty succumbed to her suffering, jumping into the frozen Winooski River now 6 years ago. But unfortunately, this story has a coda. Her son, while in treatment for his schizophrenia, but in a marijuana-triggered psychotic episode, has mistaken belief that his 80-year-old father's cell phone was a threat. And in response, he assaulted his widowed father, seriously injuring him. Cannabis-induced psychosis and addiction impacts the individual as well as the family surrounding and supporting the affected person. With all these lessons learned from cannabis commercialization in the United States and Canada and other countries, has the time come to publicly acknowledge the risks and harms resulting from cannabis use and implement an effective, enforced drug policy? Thank you for your time.